What if you woke up and saw blood after stooling? Prostate. Day 1. You go to the bathroom, you finish stooling. Then you look down. There is blood. Bright red. Fresh. Your heart starts racing. Your mind jumps to the worst possible thing. Is it cancer? Is something bleeding inside you? For some men, blood after stooling may not come from the stool itself. It may come from the prostate area. The prostate is a small gland that sits below the bladder. It surrounds the tube that carries urine out of the body. When the prostate becomes swollen, infected, or enlarged, it can create pressure deep inside the pelvis. That pressure can make every trip to the bathroom painful. At first, the blood may only appear as a few drops on the tissue, but inside the body, something may already be irritated. Day 2. The next day, you go again. This time, there is more discomfort. You feel pressure deep inside your lower stomach. Your rectum feels sore. Your pelvis feels heavy. You may notice a burning feeling when you urinate. You may start peeing more often, especially at night. The prostate may be swollen. When stool passes through the rectum, it pushes against the inflamed area nearby. That pressure can irritate blood vessels. Tiny blood vessels can break. That can leave streaks of blood in the toilet or on the toilet paper. Some men also feel pain between the legs. Others feel pain in the lower back. Some even feel pain after ejaculation. Day 3. Now the bleeding keeps happening. You start getting nervous. You avoid using the bathroom. But holding it in only makes things worse. Hard stool creates more pressure. More pressure means more irritation. The swollen prostate may keep pushing against nearby tissues. You may start to feel like you cannot fully empty your bladder. You stand there, waiting. Only a weak stream comes out, drop by drop. You may also notice fever, chills, body weakness. That can happen if the prostate is infected. This is called prostatitis. Inside the body, immune cells rush into the prostate. The gland swells. Fluid builds up. The pressure increases. Everything in the pelvic area becomes inflamed. Day 4. Now the symptoms are harder to ignore. The bleeding may become darker. The pain may spread. Your lower back hurts. Your groin hurts. Sitting becomes uncomfortable. Walking feels strange. Urinating burns. Stooling burns. Some men suddenly cannot pee at all. The swollen prostate can squeeze the urethra shut. The bladder keeps filling, but nothing comes out. The pressure becomes intense. The lower stomach becomes swollen and tight. At this point, it becomes an emergency. Day 5. For some men, the bleeding is not caused by the prostate itself. It may come from hemorrhoids. It may come from a tear in the anus. But sometimes blood after stooling can be a warning sign of something more serious. The prostate can become extremely enlarged. In rare cases, prostate cancer can spread into nearby tissues. Tumors can press on the rectum. They can damage blood vessels. They can cause pain, bleeding, weight loss, and weakness. Many men ignore the first warning sign. They tell themselves it is nothing. They wait. Days become weeks. Weeks become months. And by the time they finally see a doctor, the problem has become much worse. Your final warning. If you ever see blood after stooling, do not ignore it. Even if it only happens once. Even if there is no pain. Your body may be trying to warn you. The sooner you find the cause, the better your chance of stopping it before it gets worse. Because sometimes a few drops of blood are not just blood. They are the first sign that something inside the body is going wrong. Please don't forget to subscribe, share, comment, and like this page.